What if I told you that two simple ingredients sitting in your kitchen right now could dramatically transform your cardiovascular health and physical vitality in ways that might surprise even the most seasoned health professionals? I am Dr. Charlotte Hayes, and in my years of practice as a urologist specializing in male health and vascular function, I have witnessed countless patients struggle with declining circulation, reduced energy, and diminishing physical performance. But here is something remarkable. Emerging research and clinical observations are revealing that a specific combination of extra virgin olive oil and apple cider vinegar, when consumed correctly and consistently, may support blood flow improvement that rivals some pharmaceutical interventions. Now, before you dismiss this as another internet health fad, I want you to stay with me because the science behind this combination is genuinely fascinating, and the mechanisms at play involve some of the most fundamental processes in human physiology. Let me start by explaining why blood flow matters so profoundly to every aspect of your health and vitality. Your cardiovascular system is essentially a complex network of highways delivering oxygen, nutrients, hormones, and immune cells to every single tissue in your body. When this system functions optimally, you experience sustained energy, sharp mental clarity, robust physical performance, and yes, optimal function in areas that many men find increasingly challenging as they age. The endothelium, which is the delicate inner lining of your blood vessels, plays an absolutely critical role in regulating blood flow through the production of nitric oxide. This molecule acts as a powerful vasodilator, meaning it signals the smooth muscle in your arterial walls to relax and expand, allowing increased blood volume to flow through with less resistance. As we age, endothelial function naturally declines, nitric oxide production decreases, and blood vessels become less responsive and more prone to constriction. This is where our two remarkable ingredients enter the picture. Extra virgin olive oil is far more than just a cooking fat. It represents one of the most thoroughly researched functional foods in nutritional science, particularly regarding cardiovascular health. The key lies in its unique composition of bioactive compounds, especially a class of polyphenols that exert powerful effects on vascular function. One compound in particular, called oleocanthal, has been shown in research to possess anti-inflammatory properties comparable to certain pharmaceutical agents. Chronic low-grade inflammation is one of the primary drivers of endothelial dysfunction, creating a cascade of problems that restrict blood flow and contribute to vascular aging. When you consume high-quality extra virgin olive oil regularly, these polyphenols begin accumulating in your system and actively combat inflammatory processes at the cellular level. But the benefits of olive oil extend well beyond inflammation control. The predominant fatty acid in olive oil is oleic acid, a monounsaturated fat that your body uses to construct cell membranes, including those of endothelial cells lining your blood vessels. When these membranes incorporate oleic acid, they become more fluid and flexible, improving cellular communication and responsiveness to signals that regulate blood flow. Research has demonstrated that populations consuming Mediterranean diets rich in olive oil show significantly better endothelial function and lower rates of cardiovascular disease compared to populations consuming typical Western diets high in saturated fats and processed oils. The difference is not marginal. We are talking about measurably improved arterial responsiveness and blood flow capacity. Additionally, extra virgin olive oil contains significant amounts of vitamin E and other antioxidants that protect the delicate nitric oxide molecule from oxidative degradation. You see, nitric oxide has a relatively short lifespan in your bloodstream. Free radicals and reactive oxygen species can destroy it before it completes its vasodilatory mission. The antioxidants in olive oil act as bodyguards for nitric oxide, extending its activity and allowing it to exert its blood flow enhancing effects for longer periods. This protective mechanism is absolutely crucial for maintaining optimal circulation throughout the day. Now let us turn our attention to the second ingredient, apple cider vinegar. This fermented product has been used therapeutically for thousands of years, but modern science is only beginning to unravel the mechanisms behind its remarkable effects on human physiology. Apple cider vinegar contains acetic acid as its primary active component, along with beneficial enzymes, probiotics, and trace minerals that survive the fermentation process. When you consume apple cider vinegar, particularly in its raw, unfiltered form containing what is called the mother, you are introducing a complex mixture of bioactive compounds that interact with multiple physiological systems simultaneously. The acetic acid in vinegar has been shown to influence nitric oxide production through several pathways. First, it appears to enhance the activity of endothelial nitric oxide synthase, which is the enzyme responsible for producing nitric oxide in the lining of your blood vessels. By upregulating this enzyme, acetic acid effectively turns up the production of your body's natural vasodilator, leading to improved arterial relaxation and enhanced blood flow. Second, vinegar consumption has been demonstrated to improve insulin sensitivity and glucose metabolism. This might seem unrelated to blood flow at first glance, but insulin resistance and elevated blood sugar levels are among the most potent destroyers of endothelial function. When blood sugar remains chronically elevated, it triggers a process called glycation, where sugar molecules bind to proteins, including those in your arterial walls, creating advanced glycation end products that stiffen vessels and impair their ability to dilate properly. By helping regulate blood sugar levels, vinegar protects against this damaging process. Furthermore, apple cider vinegar has been shown to positively influence lipid profiles, particularly by supporting healthy triglyceride levels and promoting favorable ratios of different cholesterol particles. High triglycerides and certain lipid imbalances contribute to endothelial dysfunction and atherosclerotic plaque formation, which progressively narrows arteries and restricts blood flow. The mechanisms appear to involve both reduced hepatic lipid synthesis and enhanced fat oxidation, creating a metabolic environment more conducive to vascular health. But here is where things become truly interesting. When you combine olive oil with vinegar, you are not simply adding two beneficial substances together. You are creating a synergistic interaction where each ingredient enhances the bioavailability and effectiveness of the other. The fat in olive oil improves absorption of certain compounds in vinegar, while the acidity of vinegar may enhance the release and absorption of polyphenols from olive oil. This concept of food synergy is increasingly recognized in nutritional science as critical for understanding how whole foods and traditional food combinations provide benefits that isolated nutrients cannot replicate. Let me explain the practical preparation and consumption protocol that clinical observations suggest may be most effective. You want to use genuine extra virgin olive oil, preferably one that has a harvest date on the bottle and comes from a reputable source. The polyphenol content of olive oil varies dramatically based on olive variety, growing conditions, and processing methods, so quality matters immensely. Similarly, your vinegar should be raw, unfiltered apple cider vinegar containing the mother culture, which appears as cloudy strands in the liquid. This is not an aesthetic flaw, but rather an indication that beneficial enzymes and probiotics remain intact. The recommended mixture consists of 1 tablespoon of extra virgin olive oil combined with 1 tablespoon of apple cider vinegar, diluted in approximately 8 ounces of water. The dilution is important because undiluted vinegar can be harsh on tooth enamel and the esophageal lining, particularly when consumed regularly. Some people add a small amount of raw honey to improve palatability, though this is optional. The optimal timing appears to be first thing in the morning on an empty stomach, approximately 20 to 30 minutes before your first meal. This timing allows the active compounds to be absorbed efficiently without competition from other foods, and sets a positive metabolic tone for the day ahead. Consistency is absolutely crucial for experiencing the potential benefits. Your vascular system responds to sustained, repeated signals over time rather than sporadic interventions. Think of this practice as a daily investment in your circulatory infrastructure. The improvements in endothelial function, nitric oxide production, and arterial responsiveness develop progressively as your body adapts to the regular influx of these beneficial compounds. Many individuals report noticing subtle improvements in energy and physical responsiveness within the first 2 to 3 weeks, with more pronounced effects emerging over 2 to 3 months of consistent use. It is worth addressing some common concerns and potential considerations. First, if you are taking medications that affect blood sugar, blood pressure, or blood clotting, you should consult with your healthcare provider before starting this protocol, as the metabolic effects of vinegar could potentially interact with certain medications. Second, some individuals experience mild digestive discomfort when first introducing vinegar, particularly if they have sensitive stomachs. Starting with a smaller amount, perhaps 1 teaspoon instead of a tablespoon, and gradually increasing over 1 to 2 weeks can help your system adapt. Third, always rinse your mouth with plain water after consuming the mixture to protect tooth enamel from acid exposure. The potential magnitude of blood flow improvement with this combination is genuinely remarkable when we look at the cumulative effects. Enhanced nitric oxide production, reduced inflammation, improved lipid profiles, better glucose regulation, and protected endothelial function all contribute to a vascular system that can deliver blood more efficiently to all tissues. While individual responses vary based on starting health status, genetics, and overall diet quality, clinical observations suggest that consistent use of this olive oil and vinegar combination as part of a broader health-conscious approach can support substantial improvements in circulation and related parameters. Now, beyond the direct vascular effects, there are additional systemic benefits worth mentioning. Both olive oil and vinegar have been associated with improved gut health, which we now understand plays a far more significant role in overall health than previously recognized. Your gut microbiome influences inflammation levels throughout your body, affects nutrient absorption, and even produces compounds that directly impact cardiovascular function. The polyphenols in olive oil serve as prebiotics, feeding beneficial bacteria, while the probiotics in raw vinegar directly contribute to a healthier microbial balance. This gut-vascular connection represents another pathway through which this combination may support improved blood flow. The anti-inflammatory effects deserve special emphasis, because chronic inflammation is now recognized as a fundamental contributor to virtually all age-related diseases, including vascular decline. When inflammation persists at low levels throughout your body, it creates an environment where endothelial cells become dysfunctional, arterial walls stiffen, and blood flow becomes progressively restricted. The powerful anti-inflammatory compounds in both olive oil and vinegar work through different mechanisms to quiet inflammatory signaling, creating conditions where your vascular system can function more like it did in your younger years. Additionally, both ingredients support healthy blood viscosity. When blood becomes too thick or sticky, it flows less efficiently through smaller vessels, requiring higher pressure to circulate effectively and creating additional strain on your cardiovascular system. The fatty acids in olive oil and certain compounds in vinegar appear to support optimal blood fluidity, making circulation more efficient and reducing the workload on your heart. The antioxidant protection provided by this combination cannot be overstated. Every moment of every day, your cells face oxidative stress from normal metabolism, environmental toxins, and various stressors. This oxidative damage particularly affects the cardiovascular system because endothelial cells and the nitric oxide they produce are extremely vulnerable to free radical attack. The concentrated antioxidants in extra virgin olive oil, working alongside the beneficial compounds in vinegar, create a defensive shield that preserves vascular function and maintains the integrity of blood vessel walls. One aspect that particularly interests me as a urologist is the specific relevance of improved blood flow to male sexual function. Without getting into unnecessary detail, adequate blood flow to all tissues is absolutely essential for normal physiological function, and the mechanisms we have discussed apply throughout the entire vascular system. Many men who have adopted this daily practice report improvements in areas they had resigned themselves to accepting as inevitable consequences of aging. While this combination is not a targeted intervention for any specific condition, the systemic improvement in circulation naturally benefits all vascular-dependent functions. The beauty of this approach lies in its simplicity and accessibility. Unlike complex supplement protocols requiring multiple pills and precise timing, or pharmaceutical interventions with potential side effects, this combination uses whole foods that humans have safely consumed for millennia. You are not introducing foreign substances into your body, but rather providing concentrated nutrition that supports your inherent physiological processes. Your body knows what to do with these compounds because they have been part of human diets throughout our evolutionary history. I want to emphasize that while this olive oil and vinegar combination shows impressive potential for supporting vascular health and blood flow, it works best as part of a comprehensive approach to wellness. Your cardiovascular system responds to everything you do, what you eat throughout the day, how you move your body, how you manage stress, and how you sleep. This daily mixture can be a powerful tool, but it functions most effectively when integrated into a broader pattern of health-supporting choices. For those interested in maximizing the potential benefits, consider the quality of your olive oil and vinegar as investments in your health rather than expenses. The difference between genuine extra virgin olive oil, rich in polyphenols and lower quality oils, is substantial in terms of bioactive compound content. Similarly, raw, unfiltered apple cider vinegar contains enzymatic activity and probiotic cultures that processed versions lack entirely. The slightly higher cost of quality ingredients pays dividends in actual physiological effects. In conclusion, the combination of extra virgin olive oil and apple cider vinegar represents a remarkably simple yet scientifically grounded approach to supporting optimal blood flow and cardiovascular function. The mechanisms are clear: enhanced nitric oxide production, reduced inflammation, improved endothelial function, better metabolic health, and comprehensive antioxidant protection. The practice requires minimal time and effort, uses readily available ingredients, and fits seamlessly into daily routines. For men concerned about maintaining vitality, physical performance, and overall health as they age, this daily ritual offers a practical strategy backed by both traditional wisdom and modern research. I encourage you to give this approach a genuine trial of at least 8 to 12 weeks, maintaining consistency and paying attention to how your body responds. The potential benefits to your circulation, energy, and overall wellness may surprise you. Thank you for watching. I am Dr. Charlotte Hayes, and I appreciate your time and attention to this important topic. If you found this information valuable, please subscribe to the channel for more evidence-based health content. Here is to your health and vitality.